In this video, we're going to be going over the Kinin system. One of the main products of the Kinin system is going to be bradykinin. Bradykinin is going to be responsible for the sensation of pain. Let's write this down. Bradykinin is responsible for the sensation of pain. We also have prostaglandins in our body. More specifically, prostaglandin E2 is going to increase free nerve ending sensitivity to bradykinin. Now, our liver is going to produce 3 proteins that is going to be very important for the Kinin system. So the liver is going to produce factor 12, prekallikrein, as well as high molecular weight kininogen. So these 3 proteins are going to be produced by the liver, and they're going to be freely floating around our blood. Here I am drawing endothelial cells. So because these are endothelial cells, we know that we are in the blood vessel. If there is damage to a endothelial cell, so let's say that there's damage here, what happens is tissue collagen gets exposed. So this is tissue collagen. And as I said before, the 3 proteins produced by the liver freely floats around the blood. So here's factor 12. When there is endothelial damage and when tissue collagen gets exposed, tissue collagen can activate factor 12. So here's factor 12A, or activated factor 12. Now, prekallikrein is another protein that is produced by the liver that freely floats around the blood. And when factor 12 gets activated, it can do 2 things. First, it can start the coagulation cascade, which we will discuss in another video. And it's also not relevant to the Kinin system for now. Factor 12A can convert prekallikrein to kallikrein. And the significance of this is that kallikrein can then convert high molecular weight kininogen to bradykinin. Now, the effects of bradykinin are going to be vast. It can result in smooth muscle constriction of the bronchi to result in dry cough. It is also responsible for some of the signs of inflammation. It can lead to arterial dilation, which leads to warmth and redness. It can increase postcapillary permeability, which leads to swelling. And as we mentioned earlier, it increases nerve ending sensitivity to pain. So it's also going to be responsible for the sensation of pain. Now, clinically, bradykinin is relevant when it can't be properly degraded. The way bradykinin gets degraded is through something called C1 inhibitor, as well as with the help of angiotensin converting enzyme. So as you can imagine, one of the side effects, although rare, of ACE inhibitors is increase in bradykinin levels, which can result in angioedema. If there is C1 inhibitor deficiency, if a person has C1 inhibitor deficiency, then what happens is they have hereditary angioedema, because one of the side effects of bradykinin, increased levels of bradykinin, can be swelling. And one of the dangerous things that we have to look out for in these patients is suffocation. Because bradykinin freely travels around the body in our blood vessels, it can reach the trachea as well as the respiratory system, and it can result in suffocation of the patient. Now, C1 inhibitor, it can be confusing because C1 inhibitor is also plays a role in the complement system. So normally, C1 inhibitor inhibits the activation of C1, and if there is a C1 inhibitor deficiency, then C1 can be activated, and the downstream effect of activated C1 is to activate C4. And that is how we can diagnose hereditary angioedema, by observing low C4 levels in the body, because C4 is activated to C4A. So that is how we can diagnose hereditary angioedema. So diagnosis can be made with low C4 levels. So let's summarize C1 inhibitor deficiency and when it can result in. So C1 inhibitor deficiency can result in high levels of bradykinin. High levels of bradykinin can lead to swelling, also known as angioedema. C1 inhibitor deficiency can also result in low levels of C4 and high levels of C4A. And the diagnosis can be made with low levels of C4.